I'm Mike Royer with an extended interview in this Health Matters Web Extra. Welcome into another segment of Health Matters. My name is Mike Royer, speaking to you off camera. And our guest on camera is Dr. Marissa Giggie. She is an associate professor of psychiatry and behavioral medicine with University Medical Center. Dr. Giggie, you've been with us several times before. It's good to see you again.
Thank you.
You're a psychiatrist. You deal with folks during some of their most challenging times. And so we appreciate your expertise on a variety of subjects. Today we're talking about bullying, and in my age group, bullying was face-to-face on the playground or somewhere else. But cyberbullying is something new to us over the past decade or two. What is the kind of the classic definition of cyberbullying? How does it take place?
Well, cyberbullying, or often called cyber harassment, is when any form of bullying occurs on a technological sphere. So it could be on the internet through gaming, it could be through a computer, it could be through social media, it could be through a cell phone. So it's using technology to harass or bully either a person or a group, and it occurs in multiple forms. It could be verbal abuse, it could be posting someone's personal information without their consent. It could be trying to shame someone on a social media group. It can take multiple forms. And so that's a sort of a general description of cyberbullying.
And I assume then that with that description you just given us, it can be from very subtle to very blatant. Is that accurate as well?
Absolutely.
So you've been around me enough to know I'm not that deep of a thinker. I'm not as smart as Dr. Giggie is, but if someone was picking on me or making fun of me in person or on social media, I would go, well, I'm not following you anymore. I'm not participating anymore. That's easily said. For some folks, it's not always easily done. Help us understand why people just don't go, no, you're not doing this to me. What happens?
Well, over the last, say, 10 to 15 years, being part of social media and connected to people in that way has become more and more important for both kids and adults. Those connections have become really critical for people, especially for children. So being cut out from that is very hard for folks. They become connected through Facebook or through Instagram or whatever community they are part of. And so being able to just disconnect from that is really hard for people, especially for kids.
You make a great point. I'm on Twitter, I'm on Instagram, and I'm on Facebook. I have no idea how many people follow me, who follows me, who unfollows me, because my age group, I don't care. But tell that to a teenager who that is their social life, they care a great deal, don't they?
They absolutely do.
And so when you counsel them, and when you talk to young people especially, but anyone who is dealing with bullying, cyberbullying specifically, what guidance do you give them? It would be easy for me to tell them, well, get off of there, just don't pay any attention. You probably don't tell them that. What guidance do you give in counseling?
Well, if a kid is getting cyberbullied, I advise them to let an adult know and report it, because there's really very little that child can do to control the behaviors of the other people involved in it. Especially if it's, say, a group from school or something that's an organized group, like on Instagram or Facebook or Snapchat, whatever groups that they're part of. So I'd say report it to an adult, the parent ideally, or someone at school if it's happening with another child from school. So I'd say make sure someone understands this is happening so it can be addressed. But if you tell a child or an adolescent to stop using social media, that is going to be very difficult for them to do. So you need to get their parent involved. And I think that's the key.
Also, taken to the extreme, this isn't just an annoyance. It can lead, I assume, to some long-term serious mental challenges for a young person whose identity is who they associate with, what group they're a part of.
Definitely, and that's the concern. There's a lot of data to show that when kids are cyberbullied, or even adults, it can affect their self-esteem, it can make them more anxious, it can contribute to depression. In the worst case scenario, it can lead to self-harm, and has even led to suicide, unfortunately, with some cases that are well known. And so these are the consequences, mental health consequences of cyberbullying. So we need to be pretty vigilant about it and aware of what's going on with our kids.
For the parents watching, for adults who might be able to assist young people they care about or their own children, what can adults be on the lookout for? I don't know how many parents really monitor all the social media their children do. I'm sure some do, but what are some of the red flags you'd tell parents to keep an eye out for?
I'd say the major red flags are major changes in behavior. So more social isolation, if grades are dropping, if they stop interacting with their friends or their peers. That's a big red flag. If parents notice that a child is spending more time in his or her room, not wanting to talk to family on their computer or cell phone or whatever device they're on, and that's mostly what they want to do, then those are the things that I would worry about. Not wanting to participate in activities that they normally want to participate in. So just be aware. I mean, I always recommend that parents know what sites their kids are on and have parental controls. However, it can be really sneaky because a lot of this can occur on what we consider to be safe sites and even happen through gaming sites. So it happens through these online gaming platforms. And so you have to just be constantly sort of listening, observing, and being aware of what your kids are doing, because you can put all the parental controls you want on it, but it can still occur.
Is this a challenge for professionals like you? Because there's a learning curve for you all. We haven't always had social media. You've probably counseled people a few years back that weren't hardly involved in social media. So is that a challenge for your profession to kind of learn along and stay with young people as they're exposed to more and more technology?
Definitely, and it's something now that I do whenever I see a new patient. I ask them about their technology usage and what websites they're on, what social media platforms they're part of, how much time they spend on social media. I used to never do that, say 15 years ago, because it wasn't really as much of an issue. So it's become part of my intake. It becomes part of my follow-up visits. I ask about it, talk about it with parents. And interestingly, but sadly, in the last, say, 5 years, we know from data of children that are admitted to psychiatric facilities, up towards 60 to 70% of those admissions, especially related to suicidal threats, are related to some sort of cyberbullying. So we know that it's having an impact on mental health.
I'd like to end on a positive note, and the positive note is there's help out there. People like you, other professionals can provide guidance, counseling, and hopefully prevent cyberbullying from getting out of control where actual life is in danger. And so that's the best we can hope for, that people will recognize it and then reach out for help.
Yes.
Very good. Dr. Marissa Giggie, thank you. I'm sorry, we have to talk about something that the technology is wonderful, the things we can transmit and share, and that's not always positive things. And thanks for bringing this to our attention. And we always appreciate your expertise and your time. Thank you.
Thank you so much.